Let's look at the results from providing and not providing access to health care. This is a graph of death rates by age, comparing ours in the United States to those in 16 peer countries, large, wealthy countries that provide health care to all of their residents, like Canada, England, France, Germany, Switzerland, Australia. At most ages, we rank below all of the other 16 countries, literally dead last. Our children, college students, teenagers, young parents and professionals, then mature leaders in our workforce, all die at higher rates than do their cohorts in nearly every other country. If this looks like a disaster, it's because it is. How do we let this happen? But then the graph takes a sudden turn. Right around age 65, things begin to look up. We begin to die at lower rates than folks in some of these other countries. And by the time we're 85, we die at lower rates than our peers in nearly every other country. What accounts for the difference in our death rates? It's painfully obvious. At 65, everyone gets access to health care through Medicare. When we reach 65, all of us can finally get the health care we need, and we rapidly begin to outlive our international peers. Well, let's put a real number on this. That gaping white area on the left portion of the graph represents lives lost. Lost largely because of lack of access to health care. A recent Harvard study says that around 45,000 Americans die every year as a direct result of not having health insurance. So look at it this way. If you're one of the 30 million of us who doesn't have health insurance, your risk of dying is 40% higher than those who have insurance. That's not because you're a bad person who smokes or takes drugs or is overweight. It's because you can't get the health care that you need for whatever medical condition. Not having health insurance is very, very bad for your health. You may say, well, I have insurance, so why should I care? Well, you may now, but are you confident that you always will? Perhaps one of your children may not. They or you might get injured or fall sick between jobs during a period of not having insurance. Your barber or hairdresser, yard man, housekeeper, or self-employed home repair persons very likely don't have health insurance. People who you care about, who are part of your life, they have a 40% higher risk of dying than you just because you have health insurance. We should and must do something about this. That something is improved Medicare for all, with everybody in, nobody out.